Hello, my name is Dr. Jeffrey Klein. I'm the inventor of Tumescent Local Anesthesia. Today I would like to talk to you about the use of adits for tumescent infiltration. An adit is an engineering term that describes a little side tunnel used by engineers to drain tunnels or caverns of fluid. So this, an adit in the terms of dermatologic surgery and tumescent local anesthesia is a small hole placed in the skin that allows an infiltration cannula or a liposuction cannula to enter the subcutaneous tissues with minimal damage to the epidermis around the adit. There are 3 different sizes of dermatologic biopsy punches that we use for this. 1 millimeter biopsy punch, a 1.5 millimeter, and a 2 millimeter. The 1 millimeter punch is usually used just for tumescent infiltration, and we use the larger 1.5 and 2 millimeter adits for liposuction, to accommodate liposuction cannula. The advantage of using an adit created by a biopsy punch rather than using a needle or a small scalpel blade to create entrance to the subcutaneous tissue is that with repeated entrance, to and fro movement of an infiltration cannula or liposuction cannula in a tight incision, there is going to be trauma to the epidermis and consequently post-inflammatory hyperpigmentation. By using an adit, there's less trauma at the entrance site than with a scalpel blade or a large bore hypodermic needle to create the entrance. Also, the use of the adits allows for some drainage after the procedure. After a surgical procedure such as liposuction, an adit, an open adit, a round hole, doesn't close off automatically like an incision would, and this allows drainage of the post-surgical procedure blood-tinged anesthetic solution. If that solution is trapped under the skin after liposuction, the healing and swelling persists and the healing is delayed. If we can accelerate the post-operative drainage of this blood-tinged anesthetic solution with garments and binders and open adits, the healing occurs much faster. In fact, our patients only need to wear post-operative binders or garments for 2 to 3 days, and the swelling is largely gone by that time. By using adits created by small dermatologic biopsy punches, we can minimize trauma to the epidermis, minimize post-inflammatory hyperpigmentation, and optimize the use of tumescent infiltration cannulas. Thank you. If you should like some more academic information about tumescent lidocaine anesthesia, go to tumescent.org. If you'd like information about the surgical devices and tumescent infiltration equipment, go to hksurgical.com. Thanks.